Hello again. So this is the third in the series regarding fibroids, and in this one we're looking at radiological ways, so X-ray if you like, ways to treat fibroids. I'll go through what they are and explain the risks and benefits of each. One of these is uterine artery embolization, or uterine fibroid embolization, often abbreviated to UFE, or magnetic resonance focused ultrasound or high intensity focused ultrasound. Now this used to be carried out in an MRI department but can be carried out in an office setting. So let's talk about uterine fibroid embolization. This is a procedure where basically they put a tube in through the blood vessel in the thigh, feed it round through the arterial network to the blood supply of each fibroid, and block it off with some fibers. And they're called spindles really, but basically it blocks the blood supply off to the fibroid, and as a result the fibroid dies and shrinks down. So these are the benefits with uterine fibroid embolization. You get a 30 to 45% shrinkage in the size of the fibroid. So the fibroid doesn't go away, but it gets smaller, and therefore you get a less mass effect, pressure effect, and you also get theoretically less bleeding following the procedure. Because it doesn't involve surgery, there's less pain, although the pain does last a little longer. Again, because there is less pain, you return to work quickly and should recover much quicker than following surgery. And finally, you stay in hospital shorter than if you had surgery. Most patients can either go home the same day or they stay overnight. But we know there are some risks with the procedure. It's a procedure that's done by imaging, so basically you're looking at a screen, you don't see anything with the naked eye, and you're looking at essentially X-ray pictures of where the blood vessels are and where the fibroids are to direct you. So you can get more complications with it. There is also a higher failure rate with the larger fibroids. They may not shrink down very much or may not respond at all to the treatment. Because of the more complications and the higher failure rate, there's a higher rate of what we call reintervention, either needing repeat procedures or having alternative procedures such as a laparoscopic myomectomy to remove the fibroid. And because the fibroid doesn't go away, you need regular hospital visits to check that it is shrinking and responding to the treatment. Now, the other radiology treatment method is high-intensity focused ultrasound. We always call it HIFU. And basically, this is where you use an ultrasound machine to release high-intensity focused ultrasound that is directed towards the fibroid and causes the fibroid to basically break down from inside and die. So again, getting it to shrink. In the old days, it used to be done in a big MRI machine. But now the machines are getting a lot smaller, and you can actually do it in an outpatient setting in a normal gynecology clinic, and you can go home straight away. These are the benefits from HIFU. So you don't need any cuts or anything to do the procedure. It's done all from the surface. As I said, the high-intensity ultrasound causes necrosis or death of the fibroid to get it to shrink down. It can be carried out in the outpatient department. And you get a 40% reduction in the fibroid volume. Now, the risks and complications of this procedure. There really is no evidence as to the maximum number of fibroids you can treat with it, but it is limited. If the fibroid is on a stalk and pointing into the lining of the uterus, then doing this procedure may result in the fibroid breaking off the stalk, and then you have a large mass of dead tissue inside the uterus, and that takes time to come out and cause a lot of crampings and may need procedures to remove it. It can't be carried out if you have what we call intervening tissue between the fibroid and the machine. So the beam should go directly through skin, muscle, and to the uterus, and directly into the fibroid. Now, if you have intestines lying in between, or the bladder is full or something like that, then that's a risky procedure and it should not be carried out. The current recommendations that are around say you shouldn't treat fibroids that are greater than 10 centimeters and you shouldn't treat more than 5 fibroids. I'm not entirely sure how successful treatment of a 10 centimeter fibroid will be, but I don't think it will relieve the symptoms. So these are the two methods for treating fibroids with radiology. But the issue is that we know that they can theoretically affect the blood supply to the uterus, especially with embolization. So the recommendation that was made was that people who have not had children don't have this as a primary therapy. But we also know that a lot of people who have had these treatments have been able to get pregnant and conceive without any problem. So the views may change regarding this recommendation with time. I hope this is helpful, but if you want more discussion, please contact your doctor and they can explain everything fully.